Has your doctor asked you, let's get a PET scan done, or shall we go ahead with a PET scan? So you must be wondering, what exactly is this PET scan? Why is it more expensive than a normal scan? And should I really need to get it done? Hello everyone, I'm Dr. Arun Chandrasekharan and I'm a medical oncologist practicing in Kerala. So today we're going to talk about what exactly is a PET scan, whether it's an important test, whether it's actually required, how it works, and whether it actually changes the outcomes of cancer. What is a PET scan? A PET scan stands for a positron emission tomography. This basically is a modified version of a CT or an MRI scan where we look not only at the shape or size of the organs, but we look at the activity as well. Cancer cells have more activity than the normal tissue cells or the normal organs. So what a PET scan detects is this extra activity which shows up as a light, and it helps in knowing which parts of the body are involved with cancer and which parts have active growth and which can cause further damage in the future. So how does a PET scan work? So a patient, when doing a PET scan, is injected with a radioactive compound of glucose known as 5-FDG, which stands for fluorodeoxyglucose. So this radioactive sugar is injected into the body, and the cancer cells really love sugar, so they take up more of this glucose more than the other surrounding cells in the body. And this is what causes the cancer cells to light up differently from the surrounding normal cells. This difference is picked up by the PET scan scanner, which shows this lighted up area against the background of the organs. Now this helps you in staging or detection of cancer. Why is PET scan done in cancer? PET scan is mainly done for the staging of cancer. Once you have a diagnosis of cancer confirmed, then you can find out where all it has spread, whether it is either stage 1 or 2 or more advanced stages like 3 and 4. The second reason is to look for treatment response. So if you give a treatment and your PET scan shows a decrease in the activity, that tells you that the treatment is working. Thirdly, a PET scan helps detect recurrences. So a patient who is on follow-up, who has some symptoms or who have some abnormality in their bloods, we tend to prescribe a PET scan to easily pick up any small recurrences in the patient. For example, in lung cancer, we use PET scan to stage the tumor and to find out if there's any lymph nodal spread. If you find this, sometimes we may not be able to do surgery. Secondly, in lymphomas, we use PET scans for complete staging, as lymphomas are very sensitive to this glucose and they show up very easily, and it's also used to look for response of lymphoma to our treatment. Thirdly, in colon cancer, we use a PET scan to detect any hidden cancer spread in the liver, which may alter the treatment plan for that patient. What to expect before a PET scan? Usually we need to be in a fasting state without any food for 4 to 6 hours. The reason we say this is because this glucose needs to enter the cancer cells, and when we are in a fasting state, the cancer cells are the most hungry and they easily take up this radioactive glucose, and so you get a very good scan. After this fasting is done, the patient is injected with the radioactive glucose and he has to wait for 45 to 60 minutes while the glucose is absorbed in the body. After that, the patient is taken for a scan, and the scan usually takes around 15 to 20 minutes and it's quite fast. And then after some rest and then having food, the patient can go home. The whole process, once you reach the hospital, probably is over within 1 to 2 hours. So finally, do we need PET scan for everyone? Not really, but many cancers are easily picked up with PET scan, and the treating oncologist will be able to advise you on how necessary it is. It is an expensive test costing between 15 to 20,000 rupees, but it helps us give a proper direction and treat the patient in a smarter way. It can also help avoid unnecessary surgeries or unnecessary treatments. So in short, a PET scan is a definitely important tool in the armamentarium against cancer, and it helps detect actively dividing cancer cells and helps in staging and treating of our patients. So it's something that has become an essential part of cancer care and hopefully will remain so in the future. Thank you for listening. Have a happy, healthy life.